Hello, I'm Dr. Edward Archer, a research fellow at the Arnold School of Public Health at the University of South Carolina. Today, I'm here to discuss my new paper, a validation of a novel protocol for calculating estimated energy requirements and average daily physical activity ratio for the U.S. population in 2005 and 2006. This paper will appear in an upcoming issue of the prestigious journal Mayo Clinic Proceedings. I'd like to thank my co-authors and congratulate them because their contributions were invaluable to this project. The rise in the population prevalence of obesity has focused attention on U.S. national nutritional surveillance research and the analysis of trends in energy intake and energy expenditure. Because these surveillance efforts provide the scientific foundation for many public health policies and food-based guidelines, poor validity and measurement protocols can have significant long-term implications for our nation's health. I was recently the lead author on a paper that demonstrated that over 40 years of federally funded nutrition data were fatally flawed. So as such, we have no valid population-level estimates of energy intake. But more importantly, we also don't have estimates of physical activity or total daily energy expenditure. This is important because in 1957, the Food and Agricultural Organization of the United Nations, and later on in 2005, the World Health Organization, determined that food energy requirements should come from estimates of total daily energy expenditure. Yet to this day, measurement protocols for total daily energy expenditure are insufficient, and they are especially limited in their use to examine the metabolic and physiologic health benefits of physical activity. Now, physical activity is important because it is the only major modifiable determinant of nutrient partitioning. And nutrient partitioning is just a fancy way of saying what your body does with the food you eat. An individual that runs a marathon will partition his food very differently, his or her food very differently, than the individual who sat on the sofa watching the marathon on TV. So the science of nutrition demands that we know how people spend their day. In fact, the father of modern medicine, Hippocrates, 2,500 years ago, said eating alone will not keep a man well. He must take exercise. And this is very true. So my colleagues and I decided to calculate an average physical activity ratio and estimated energy requirements from a nationally representative sample of over 2,600 adults aged 20 to 74 using the NHANES, the National Health and Nutrition Examination Survey from 2005 and 2006. Now, the estimated energy requirements are really just how many calories a person needs to live their day, to survive. And this depends on their total daily energy expenditure, and total daily energy expenditure is determined to some extent by your physical activity and your basal metabolic rate. Now, your physical activity ratio is a measure of how active someone is during the day, and therefore their physical activity ratio, a higher value, will determine their nutrient partitioning and whether or not they store that energy healthfully. Now, the methods in the paper are very complicated, or the methods of the research are very complicated. There are numerous assumptions built into our model. We provide detailed descriptions of our limitations in the paper, but again, the model is quite complicated. But once we developed our protocol, we had to validate it. So we validated the PAR protocol by comparing our values to the Institute of Medicine's estimated energy predictive equations. Now, we cannot use the Institute of Medicine's predictive equations on a population level because it was non-representative. But the IOM, the Institute of Medicine, has the largest objective database of total daily energy expenditure measurements. Now, our values, the PAR-derived values, the physical activity ratio-derived values, achieved a 0.98 correlation with those from the Institute of Medicine. This is obviously a huge result, and we were quite happy with the validity of our protocol. And what we determined in 2005 and 2006 was that the estimated energy requirements for the U.S. population were 2,940 kilocalories per day for men and 2,275 kilocalories per day for women. The values ranged from 3,230 kilocalories per day in obese men, and these are men who have a BMI of greater than 30 kilograms per meter squared, to a low of 2,026 kilocalories per day in normal weight women. They have a BMI of less than 25 kilograms per meter squared. But the most important values were the average physical activity ratio values. For men, they were 1.53, and for women were 1.52. This is the first time that a physical activity ratio value has been created in a nationally representative data set, and they're indicative of an incredibly sedentary population. To give some comparison to this, an individual who's completely bedridden will have an average physical activity ratio value of about 1.35. Compared to hunter-gatherer populations or an Olympic athlete, their average physical activity ratio values will be well over 2.0. So a 1.53 and a 1.52 are incredibly low. And not surprising, obese individuals had lower activity than normal weight individuals. And this parallels research from the 1950s. And what we're seeing is a reciprocal determinism. We're seeing that inactivity is both the cause and the effect of obesity, because inactive individuals have an increased risk of obesity. And if they develop overweight or obesity, as they put on weight, they become more inactive. So the inactivity is driving their obesity, and their obesity is driving their inactivity. Given that physical activity is an absolute prerequisite for health and wellness, it is not surprising that inactivity is now a leading cause of mortality and morbidity in the world. And if we are to improve our future for our loved ones, our families, our children, we need to be more active. Both men, women, and children need to increase the amount of activity throughout their day. Hopefully our study will provide results that inform public policies about the sedentary nature of our population. And hopefully they understand that the science of nutrition demands that we know how people spend their day, because it's how they spend their day that will determine their health. How they spend their day will determine what their body does with the food they eat. Thank you for your time, and thank you for listening.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.